It's my great pleasure to talk to you about something a little bit less complex than hematology.
Tere tulemast tagasi ja meie pealelõunane loeng on arvatavasti pisut vähem keeruline kui hommikupoolne.
So probably the first thing you are thinking when you see the title of this talk is what's angiostrongylosis?
Esimene mõte, kui vaadata seda loengu pealkirja, on küsimus, et mis asi see angiostrongyulus on?
Last weekend I was in Hungary visiting Budapest, and I was giving a talk at the university there, and it was the third time I'd been back to the university, and when I first went they said exactly the same thing. What is this angiostrongylosis? I've never heard it, I've never diagnosed it.
Hiljuti ta käis Budapestis Ungaris ja rääkimas ülikoolis samast angiostrongyulosist. Ta oli seal kolmandat korda ning ütleb, et esimest korda, kui ta seal käis, siis temalt küsiti, mis asi see üldse on, et seda ei ole kunagi diagnoositud, kunagi ravitud.
So the first year that I went, 3 years ago, I said, well, how many people have diagnosed, how many vets in Hungary have diagnosed angiostrongylosis, and nobody put their hands up.
3 aastat tagasi Ungaris samasugust loengut pidades ei olnud mitte keegi kuulnudki sellisest parasiidist.
So I will do the same with you. Has anybody ever diagnosed angiostrongylosis?
Kas te olete kunagi diagnoosinud angiostrongyuloosi?
With the exception of my friend that's worked in England. In England, this parasite is commonplace.
Inglismaal on see üsna tavaline parasiit.
But the first thing we must think when somebody comes to talk to us is this a parasite that's a problem for me in Estonia?
Et kõigepealt tulebki mõelda, kas see parasiit on üldse meil, kas see meie jaoks probleem?
And the short answer is, I don't know.
Ja vastus on see, et me ei tea.
However, I will show you something of the life cycle of this parasite, and I'll show you why you should remain vigilant for this parasite. I'm not here to say that you should test every patient, but I think we should be cautiously vigilant, because if we don't have it in Estonia yet, we certainly will get it. Ta kindlasti ei väida meil, et me peaksime seda otsima igat patsiendit ja pidevalt loomi testima, kui me peaksime olema teadlikud, et selline patsient on olemas. Ta räägib parasiiti elutsüklist ja ka sellest, et miks on täiesti võimalik, et see parasiit on tegelikult ka siin olemas. So today I'll be talking about a parasite called Angiostrongylosis vasorum. I will call it Angio, because that's a lot shorter.
Ta räägib siis täna parasiidist nimega Angiostrongyulus vasorum, ehk siis lühidalt Angio.
So many people in England call it lungworm, however that's a very confusing term.
Inglismaal paljud inimesed kutsuvad seda kopsuussiks, kuid see on segadusse ajav termin.
If you go to Denmark, the worm that they refer to as lungworm is very different, and if you go to Finland, the worm they refer to as lungworm is different again.
Näiteks Taanis kopsuussiks kutsutud parasiit on hoopis teine parasiit, samuti Soomes on hoopis kolmandat liiki parasiit, keda seal kohapeal kutsutakse kopsuussiks.
So let us call this long parasite name Angiostrongyulus vasorum just Angio for short.
Ehk et õigem oleks siis temast rääkida kui Angiostrongyulus vasorum, ehk siis konkreetselt liigist.
So we'll talk in a little bit of detail about the life cycle of this parasite, as you probably haven't met it yet, but I will show you later where you can for certain find it here in Northern Europe.
Ta räägib täpsemalt parasiidi arengutsüklist ja miks see parasiit on Põhja-Euroopas olemas ja kus seda võib leida.
So the parasite is spread by consumption of slugs and of snails.
Parasiidi leviku tee on tibude ja nälkjate söömisel.
When those slugs or snails containing the infective L1 larvae are consumed either by dogs, foxes, jackals, any canid, the parasite can spread further.
Parasiit levib, kui koerad, rebased ja teised koerlased söövad parasiidi esimese vastsevormi sisaldusega tibusid ja nälkjaid.
The L3 are ingested by the host, and they develop further and come to reside within the great vessels of the heart where they reproduce.
L1 vastsed
süüakse siis nende vaheperemeestega koos sisse ja arenevad koeras organismis edasi, minnes rändele.
The females produce eggs that travel to the lungs where they hatch. These larvae are then coughed up and swallowed and pass out into the feces, ready for consumption by the slug or the snail.
Emas ussid munevad, olles sise kopsudes ja munad köhitakse välja, neelatakse alla ja parasiit levib rooja vahendusel, mida omakorda siis söövad jälle need peod ja näkkjad.
Having witnessed this parasite spread throughout Europe, or rather witnessed awareness of the parasite spread throughout Europe, there's normally incredulity that dogs will eat slugs and snails.
Näes, kuidas parasiit levib Euroopas või siis ka näes, kuidas parasiiti teadlikkus levib Euroopas esialgu, inimesed väidavad, et koerad ei söö neid tigusid ja näikeid.
But trust me, dogs either accidentally by eating grass or intentionally by finding snails and eating them will consume slugs and snails.
Koerad võivad neid süüa täiesti sihilikult, aga nad võivad neid süüa ka juhuslikult süües rohtu.
The symptoms we normally see with the dogs are cough and lethargy. To a lesser extent, we also see coagulopathies.
Haigused, kliinilised tunnused, mida me näeme selle parasiidi puhul, on köha, loidus ja mitte nii sageli, aga koagulopaatiad.
Coagulopathy is obviously a particular concern that some of these patients will die. Usually the risk of coagulopathy is over-exaggerated. It happens in a relatively small proportion of patients infected with this parasite.
Koagulopaatia on muidugi suurem risk nendest, sest et koagulopaatiaga patsient võib surra, aga üldiselt koagulopaatia risk või esinemissagedus on ülehinnatud.
So Angiostrongyulus vasorum, angio, we call it in England lungworm. In other parts of Europe they call it a heartworm, but it's not to be confused with the heartworm that you'll see in many US textbooks. There they're referring to Dirophilaria immitus, a parasite I think you're unlikely to see in this part of Europe.
See pildi on siis kujutatud Angiostrongyulus vasorum, mis on see väike uss, mida sageli mõnikord nimetatakse ka südameussiks. Kõrval on siis meil ka levinud nimetusega südameuss Dirophilaria immitus.
But usually this is all you get to see of the parasite itself. This is the infected larvae present in a fecal preparation.
Üleval pildil on nakkusvastsed, mida on võimalik siis mikroskoobi all näha roojaproovis.
So lungworm, as we call it in England, angio is probably a better term, is a life-threatening canine disease.
Angiostrongyuluse nakkus on eluohtlik koerte haigus.
It's challenging to diagnose because it presents as a wide variety of clinical signs, including cough, dyspnea, exercise intolerance, weight loss, failure to thrive, and potentially but rarely heart failure.
Haigustunnused võivad olla väga erinevad, seda võib olla raske diagnoosida just seetõttu, et väga varieeruvad on haigustunnused. Süveneb hingamisteede haigus, köhimine, hingamisraskused, tahtmatus, füüsilise koormuse talumatus, sageli kaalukaotus, ei võta kaalus juurde, koagulopaatiad ja südamepuudulikkus ei ole nii sagedased, aga neid esineb ka.
Infections can be apparently subclinical, so you will see no obvious signs in the dog. However, for some of those patients, when taken to surgery, you will see a prolonged or dramatic hemorrhage.
Haigus võib olla täiesti subkliiniline, haigustunnused praktiliselt ei ole, kuid sellist looma lõikusele viies võib juhtuda, et tegu on koagulopaatiaga, et vere hüüdlikus on takistatud.
So key opinion leaders, KOLs, are generally in agreement that this is a widespread problem for all of Europe, and to date the problem has been underestimated.
Arvamusliidrid leiavad, et see on haigus, mida esineb kõikjal Euroopas ja selle esinemissagedus on alahinnatud.
So the big question that's probably in your mind is this a parasite that I should be worried about?
Küsimus, mis ilmselt peaks olema meie meeltes, on see, et kas seda parasiit esineb ka siin.
is that coughing dog that I couldn't quite understand why it was coughing. Was that perhaps potentially due to angio?
Et kas see patsient, kes köhib ja kelle püha põhjust me ei suuda kindlaks teha, kas see võiks olla tegelikult Angiostrongyulus?
So really we want to have some information about where this parasite is found, and certainly if you were to do a literature search, it's pretty widely distributed in Europe. There are reports coming from other parts of the world, including now the eastern side of the United States.
Kui vaadata kirjandust, kus seda haigust on diagnoositud, siis seda on diagnoositud päris suures osas Euroopas ja teateid on ka tegelikult maailma muudest osadest. Eriti ta rõhutab siin Ameerika idarannikul.
What we do know from those countries where we see well-documented infections, such as the United Kingdom, is that the distribution is extremely patchy.
Hästi dokumenteeritud esinemistteadetest tuleb välja, et haiguse esinemine on erakordselt koldene.
So professors in epidemiology at places such as the RBC have mapped the spread of the disease, and they find that it's veterinary practices that are very close to each other can have a very different experience of this parasite.
Esinemist on püütud panna kaardile ja on tulnud välja, et naabruses olevate loomakliinikute teated selle haiguse kohta võib olla väga erinevad, et ühes kliinikus võib olla haigusjuhtumeid palju ja kõrval asuvas praktiliselt mitte midagi.
So the big question is, what about Estonia?
Ja loomulikult on suur küsimus, et kuidas on Eestiga?
So we have some predicted potential distribution for this parasite based upon ecoclimatic factors.
Võimalik ennustus, mis põhineb tegelikult kliimal ja ökoloogial, on kujutatud siis siin pildil.
Epidemiologists were able to look at factors such as humidity, temperature, and work out where they considered the parasite would be the most significant problem. And they decided upon the British Isles, Denmark, and areas of France, Spain, and Netherlands and the like.
Põhinedes kliimatingimustel, ehk siis temperatuur niiskus, on koostatud kõige tõenäolisema leviku kaart. Kaart on siin esitatud, et Briti saared kindlasti, Taani, Holland, Prantsusmaa rannik.
So this model was developed some time ago, and at that time we had documented infections in Denmark, the UK, Ireland and France.
Ja see siin kujutatud tegelikult ennustus, võimalik levikukaart, mis on koostatud mudeli põhjal, ja need rohelised linnukesed seal viitavad siis konkreetselt tänaseks päevaks diagnoositud haigusjuhtumitele. On esinenud Suurbritannias, Iirimaal, Taanis, Prantsusmaal.
And they predicted they would find it in other countries. And since that time, as we've had the availability of the test, we've started to look in other countries, and we now have documented infections from Portugal, Spain, Italy, Hungary, Moldova, across all of Europe, Germany, Poland. The model hasn't been exactly right, though.
Sinisega on märgitud need potentsiaalsed piirkonnad, kus võiks ka haigust esineda. See kaart ei ole täiesti täpne ajaliselt, et osadest nendest sinistest linnukestest on tänapäeval saanud rohelised, ehk et seal on diagnoositud seda haigust juba. Kindlasti see mudel ei ole 100% täpne.
So it was predicted that it would just be a so-called moderate rate in Poland, but actually now the data coming from Poland suggests that infection is more common in Poland than the UK.
Ennustati, et Poolas võiks olla haigestumus üsna mõõdukas, kuid nüüd kui test on saadaval, siis tuleb välja, et haigus on Poolas rohkem levinud kui Suurbritannias.
So we've certainly had documented infections in Sweden, and I heard last week that we've had an anecdotal report, it's not written in the papers yet, of a positive in Finland.
On leitud kinnitatud haigusjuhte Rootsist ja vastuolulist teateid Soome kohta ei ole veel publitseeritud, nii et 100% võib öelda.
So is it in Estonia? I don't know, but if I was going to make a bet, I would say that it was.
Kas seda haigust Eestis on, me ei tea, aga ütleme, et kui ta peaks kihla vedama, siis ta pigem pakuks, et on.
However, we have spent a long time looking in Belgium and only found 2 cases.
Nad on palju otsinud seda haigust Belgias ja nad on leidnud ainult paar juhtumit.
So there are clearly factors that we don't understand.
Seal on selgelt olemas mingisugused faktorid, mis haiguse levikut mõjutavad, aga mis ei ole teada.
What we do know to be important is dogs that are walking in a relatively high density in areas of high moisture content.
Üks, mis tundub mängivat rolli, on suhteliselt suur hulk koeri, kes jalutavad, kes käivad väljas niiskes piirkonnas.
So I am not here today to ask you to test every dog. All I would recommend is that you at least keep this possibility in mind, particularly if you're seeing dogs coming from other areas.
Ta ei arva, et me peaksime kindlasti kõiki koere testima, kuid me peaksime meeles pidama, et see haigus on olemas ja mõtlema sellele ka koerte puhul, kes tulevad mingist muust piirkonnast.
So until recently we had a lack of a decent diagnostic test, and so we've spent a lot of time now that we've got new diagnostic options available to us, collecting samples, and this is a study that I was engaged in the UK, where we took 4,000 samples from across the UK, and we're mapping out where we found the parasite.
Et kuni hiljutise ajani ei ole olnud olemas niisugust kergesti kasutatavat, lihtsalt kasutatavat testi, mistõttu parasiidi leidmine on olnud keeruline, aga nüüd püütakse siis koostada parasiidi leviku kaarti.
So we don't really understand why areas of England and Wales, obviously there are fewer people living in areas such as this part of Wales or this part of England, but we don't really understand why the problem is patchy.
Nad tegelikult ei tea, miks osades Walesi või Inglismaa piirkondades seda haigust ei ole diagnoositud või miks seda on diagnoositud vähe, mis selle põhjuseks võiks olla. Kindlasti oma rolli mängib see, et need on hõredamalt asustatud piirkonnad, aga siiski ei ole põhjust teada, miks neid diagnoose pole tulnud.
So what causes this patchy nature? Well, we think perhaps the urbanized fox is important.
Mis põhjustab seda, et see haiguse leidmine on selline koldeline, arvatakse, et oma rolli mängivad linnarebased.
There's one fascinating study from Denmark which showed wherever Danish people went on holiday with their dogs, we were seeing a new outbreak of the parasite.
Et on üks huvitav uuring Taanist, mis näitab, et kõikjal, kus inimesed võtsid oma koera puhkusele kaasa, tulles tagasi, seal oli uus haiguspuhang.
But what has probably been significant in many markets is the activity of the pharmaceutical companies.
Kindlasti mängib oma rolli paljudes piirkondades ikkagi see, kui aktiivsed on olnud ravimfirmad.
So in many parts of Europe, such as Poland, Denmark and the UK, pharmaceutical companies are advertising to pet owners, warning them of the dangers of Loengut.
Paljudes piirkondades ravimfirmad reklaamivad, et tõsta inimeste teadlikkust sellest parasiidist.
And so when I speak to the pharmaceutical companies, as I did last week about Estonia, they said, well, we don't know whether the parasite's there yet, but if we find it, you can expect this to follow.
Et ka Eestis tegelikult keegi, kuna ei teata, kas seda parasiiti siin on või ei, siis praegu midagi selles suhtes ei toimu, et parasiiti peaks leitama, et kindlasti tuleb ka reklaam.
So you have some choices when it comes to finding the parasite. One is a blood test that I will show you in a minute, and the other is the Behrman technique.
Selleks, et parasiiti diagnoosida, on paar erinevat võimalust, et ta räägib meile seroloogilisest testist verest, aga kõigepealt ta kirjeldab siis Behrmani tehnikat, kuidas parasiiti leida.
Has anyone ever done the Behrman technique?
Kas keegi on kunagi seda Behrmani meetodit kasutanud?
It's really easy to do, but it's really unpleasant.
Väga lihtne teha, aga väga ebameeldiv.
So you ask the pet owner to collect feces for 3 days.
Sa palud loomaomanikul koguda roojaproovi 3 erineval päeval.
The pet owners don't usually like to collect feces for 3 days, especially if you're asking in the cat, but in the dog, they're not keen.
Ja loomaomanikele see ei meeldi, nad ei taha seda roojaproovi 3 päeva järjest korjata. Kassidega ei ole asi nii hull, aga koertega veel eriti. Ei taha seda teha.
In the Netherlands, we typically wrap our cheese in a cloth, but any cloth with small holes in it would do.
Hollandis pannakse see proov marli sisse. Selle nimetatakse juusturiideks, aga sisuliselt on tegu marliga, võib kasutada igasugust hõredat riiet.
The idea is that you take all the feces, wrap it in this cloth with holes, and the parasite can make its way through the holes.
Idee on selles, et roojaproov pannakse siis hõredasse riidesse ja parasiit saab lihtsalt välja pugeda selle riide vahet, rooja massidest välja.
So you take the cloth and you tie it to 2 chopsticks from Chinese food.
Kasutad kahte söögipulka, paned selle riide siis nende söögipulkade vahele rippuma.
And you then float that bag of feces in water and leave it overnight.
Ja selle rooja pakikese siis jätad vee sisse ööks.
Where I worked in England in general practice, we used to do 5 or 6 of these a night, and our laboratory was very small. It's in fact underneath the stairs.
Kliinikus, kus ta töötas Inglismaal, seal tegid hea mitu tükki iga õhtul ja labor oli väga väike.
I used to come into work in the morning and there would be 8 of these, sometimes bigger buckets because it was a bigger dog, of feces that had been left in warm water overnight.
Igal hommikul tuli tööle ja siis oli seal 8 sellist pakikest, kui suurem koer, siis on ka see anum suurem.
In the morning you would come and you would take a pipette, take from the bottom of the container and then squirt that under a low power microscope.
Ja hommikul siis lähed võtad pipetiga klaasi põhjast vedelikku ja paned mikroskoobi alla, vaatad madala suurendusega.
So a very unpleasant test, but nevertheless pretty easy to do.
Väga lihtne teostada, aga üsna ebameeldiv.
This is an alternative if you don't want to use a cheesecloth.
Siin on alternatiiv siis sellele marlilapile.
As you know, in England we are very fond of tea, and this is a tea strainer with something other than tea within it.
Kui Inglismaal juuakse väga palju teed, siis seal on kasutatud teesõela.
You can imagine that both pet owners and vets hate doing this, and so the usual instinct is to treat the pet and see if it gets better.
Nii loomaomanikud kui loomaarstid tegelikult vihkavad selle proovi tegevust ja alternatiiv on need loomi ravida.
We know that the standard worming products are not efficacious against angio.
Ja on teada, et Angiostrongyuloosi vastu tavalised klassikalised tussiravud ei toimi.
However, products such as Bayer's Advocate are highly efficacious.
Samas toot nagu Bayeri Advocate on väga efektiivsed.
What we find with this parasite is that reinfection is very common.
Väga tavaline on taas nakatumine.
And so usually once we have a positive diagnosis, we would then insist on that dog being on Advocate or similar the remainder of its life.
Ja kui parasiit on leitud, siis soovitatakse kasutada Advocate'i või mõnda muud analoogset preparaati kogu ülejäänud elu.
So it is very tempting to just simply treat all dogs or to treat dogs where you suspect there's a problem. However, it doesn't really tell you which dogs need this expensive treatment and which don't.
Et on väga kiusatud, on suur kiusatus ravida lihtsalt kõiki koeri, aga see, kui sa kõiki koeri ravid, tegelikult ei ütle, kas see koer vajab seda ravi, mis on suhteliselt kallis.
So vets were crying out for a somewhat simpler way to find the presence of this parasite.
Et loomaarstid ootasid ammu juba lihtsamat viisi selle haiguse diagnoosimiseks.
So the test was developed in conjunction with the University of Zurich in Switzerland, where they developed an ELISA test to identify the infection with this parasite.
Zürich ülikoolis töötati välja ELISA test selle haiguse diagnoosimiseks ja see konkreetne toode on siis välja töötatud koostöös Zürich ülikooliga.
We need to be a little bit careful when we consider the testing options because there are in fact 2 tests, an antibody and an antigen test.
Testides peab olema teadlik, et on tegu 2 erineva testiga. Üks siis võtab kinni antikeha ja teine antigeeni.
An antigen test tells you the parasite's present today. An antibody test tells you about exposure to the parasite.
Antigeeni test ütleb, et loom on praegu nakatunud ja antikeha test ütleb, et loomal on olnud kokkupuude selle parasiitiga.
So in Poland we are finding 4–5% of dogs have been exposed to the parasite, but at any given time those with an active infection can be much lower than that.
Poolas 4–5% koertest on olnud kunagi kontaktis parasiidiga. Loomad, kellel on hetkel aktiivne nakkus, nende hulk on kindlasti väiksem.
So those tests were available from a reference laboratory. However, there was a relatively slow turnaround time and people were looking for something cheaper and quicker.
Esialgu oli test saadaval referentslaborites ja kasutati seda vähe ja vajadus oli siis millegi odavama ja kiirema järele.
And this peer-reviewed scientific paper reviews IDEX's AngioDetect, which is an in-clinic version of the test.
Et selle testist siis IDEX on teinud kliinikus kasutatava testi toote nimega AngioDetect.
You will notice it has a very high specificity, which is
testil on väga kõrge eristusvõime.
And as we establish the presence of this parasite around Europe, that high specificity, and by that I mean if it's positive, we know for certain it's this parasite and not another parasite.
Et ta 100% täpsusega ütleb, et tegu on just selle parasiidiga.
But you should be mindful that the sensitivity, whilst good, still means that it occasionally misses early infection.
Tundlikkus on suhteliselt hea, kuid peab olema loomast peab aru saama, et eriti varased infektsioonid võivad jääda diagnoosimata.
So we need to understand a little bit about the parasites to understand how the test works and what the parasite might do for our patients.
Et selleks, et aru saada, kuidas test töötab, selleks on vaja kõigepealt natukene aru saada, mis toimub, mis parasiit organismis esile kutsub ja kuidas see test töötab.
To survive and to reproduce in the circulation, the parasite must defend itself from the dog's immune system.
Selleks, et koera vereringes ellu jääda ja ennast kaitsta, peab parasiidil olema mingisugune kaitsemehhanism looma immuunsüsteemi vastu.
The parasite must also prevent blood clots from forming around it.
Ja samuti peab parasiit hoidma end selle eest, et tema ümber moodustatakse verehüüvist.
So the parasite produces a variety of compounds that inhibit clot formation and inhibit the binding of antibodies.
Seega parasiit eritab pidevalt aineid, mis väldivad verehüüvise tekkimist ning immuunsüsteemi reaktsiooni parasiidile.
It's important to understand that only the adults produce this substance.
Tuleb aru saada, et ainult täiskasvanud parasiidid eritavad neid aineid.
So if you think about a typical infection where the dog eats slugs and snails, it takes some weeks, maybe a few months, for the adults to establish.
Peale nakkuse saamist, kui koer on neid tigusid või näikeid söönud, kulub nädalaid, mõnikord isegi kuid ennem, kui parasiit jõuab täiskasvanuikka.
However, when the adults have established, there's a simple blood test. You can have 2 lines, it's positive, 1 line, it's negative.
Testil siis klassikaliselt 2 triipu on positiivne ja 1 triip on negatiivne.
The principal advantage of the test is that it avoids one of the problems we see with the Beerman test.
See test väldib ühte probleemi, mida me näeme Beermani tehnikut kasutades.
What we see if we follow a Beerman for many days in the dog, for some reason there are days when no parasites are found in the feces.
Kui teha süstemaatiliselt samal looma roojast proove, siis mingil põhjusel tekivad päevad, kui praktiliselt arve ei leita.
We don't understand why this is so, but this is the idea of why we collect 1, 2, 3, maybe even more days of feces.